Hi, everyone. My name is Carissa Brewster. I am the writer for Whitman Partners, and we are conducting our 40 Fast and Future Leaders of Surgical Services for 2023. And today we have Maurice Farwell. Welcome, Maurice.
Thank you.
You're welcome. And can you let us know your current position and the facility that you are currently at?
Yes, I'd be happy to. So currently I'm the business manager for Dartmouth Health at the Academic Medical Center, the Outpatient Surgery Center, and the Center for Surgical Innovation.
Awesome. And I just want to let our listeners know that Maurice's background is business. So I'm kind of excited to hear about the business side of perioperative.
Some professional challenges that have definitely helped me grow throughout my career. I'd have to say the diverse group that a hospital brings. I think that working alongside with surgeons, nurses, techs, PSTs, I know every hospital labels PSTs differently, but we all work together and come as one to help provide the best care to patients. I think that there are some barriers in terms of what staff think, what surgeons think, and on my side of things, I kind of have to listen to both what nurses want, techs want, and surgeons want, and try to provide the best outcome both financially and kind of from a quality standpoint of outcomes for the patient. I'd say another challenge that I face in my role currently is definitely just I know health institutions across the U.S. are facing some hardships right now in terms of finances. I think that because of numerous things and numerous ways how health institutions are deciding to tackle them, I think that we're trying to get really innovative and creative with ideas how to solve these issues. I think that one thing that we're doing here at Dartmouth Health that we just started doing is actually try to be a health system and really kind of put a lot of contracts into one. So we have a lot of master agreements instead of a lot of siloed out contracts. I know that that's going to help out a lot. We're going to have some different thresholds and it's going to be a lot of work. But I think at the end of the day, that'll be a huge accomplishment for the health institution. Currently, I've been in some conversations around trying to bring in more staff to hear what it is that they want. I think that there is that miscommunication and kind of that disconnect of where leadership's busy, staff's busy, and we don't really communicate with each other. I think the message kind of gets lost in between somewhere. Not that it's anyone's fault or anything like that, but I do believe that staff and management might have the same ideas, but we don't really talk about them. And if so, I know sometimes management might have an idea of their view and what they think is best, but staff has a different idea. And kind of implementing those changes and challenges, it's important to have everyone's ideas so that we do have the best implementation plan going forward. I think that my superpower is definitely Excel. I really enjoy pulling data, pulling numbers, trying to get the best metrics that I can show at pre-op leadership meetings. I think that we have started doing that, including all areas. So including our PACU, same day, OR, CSR. And it's interesting to see when people thought, hey, the issue's in PACU, but what they're not seeing is maybe a delay in the OR. But when PACU calls same day and says, hey, we have a hold, can you guys not go into the OR yet because someone's recovering in the OR? That communication isn't quite there and they don't really see it. But then when I started to bring metrics to some meetings, then that's when they started to see it. And I provide hold minutes. And then they said, oh, wow, this makes sense. This is why cases are getting delayed. This is why we're holding patients longer. This is why we're staying later. So I think my superpower secret sauce is pulling data, helping explain the data as to why some things are as they are. I think that the bad apple that can spoil the barrel is definitely hiring someone that doesn't quite understand the team's culture. I think here at Dartmouth, we have such a great culture and our OR group is a very tight-knit group that even hiring a bad traveler can really kind of create some turmoil in the OR, from what I've heard. And in my role on the administrative side of things, I think that it's also important whenever we're interviewing admins or senior admins, it's important that we look at, are they a good team fit? We can teach them, how to pull numbers, how to create posters and nice signs. But if they're not a well-fit personality for our group, I think that's where the bad apple comes from, or where that spoiling the barrel can come. Yeah, so currently we're actually looking at a couple different ideas of how to implement AI here. I think that there is a lot of value. Interestingly enough, I do believe that AI can help predict trends data and spit out information a lot faster than a human can. I know that it'll help with scheduling cases. I also think that because up here we do have such a harsh winter, it can prepare us for ortho trauma for skiing accidents, car accidents, compared to, say, summer. I know summer has their trauma issues as well, but just kind of seeing what instruments we use, how often is there a spike during this month or that month. We can look at that now, but I think AI is much faster and can provide results much quicker, which can save a lot of money. Probably areas of leakage or waste. I think that one thing that I really have enjoyed doing in the past couple months was looking at what surgeons are using in their pick sheets. So what they're using, the disposables, are they being wasted? Are they not? I know that we had a big project a little over a year ago where there were a ton of disposables that were supposed to go back down to our inventory and logistics team and be checked in to get reimbursed. But that being said, there was an issue with some lining up of line items, and we had a lot of waste. I think by the time we kind of figured out what we had, things expired, and unfortunately, there goes a lot of money and we can't be reimbursed for it. That being said, I do think that there's a huge opportunity to kind of go through, see what people are using, see what people aren't using, and even look at the data to say, hey, if you have a case that looks like this, similar age, look at the HSA and kind of say they're similar complexity. Do you think you need this? Do you need this? And I think that does make a world of a difference. I know some providers are, they like everything, but at the same time, it's important to see what we can do to save materials, waste, and see what we can do to kind of help save money. I think hospitals have the opportunity to increase their profitability by attracting and retaining more staff. I think that there are so many nurses that have left to go travel, and travel rates are high, which is great. And they definitely do supply that need. I know that the hiring process can take a while, but at the same time, I also think that it's important to kind of reward the staff you have and kind of see who your full-time staff are, how long they've been there, and give them rewards rather than new hires or travelers. I would definitely say that clinical and non-clinical bridge is critical. Myself personally, when I was in this role, I actually was going to request and saying, hey, I think that this is what it's called in a meeting, and they say, no, it's pronounced like this. And it would be kind of that laugh, but we did get close that way. But I think it was really important to kind of say, hey, I'm not from the clinical side. I don't understand that side so well. Do you mind sharing me some of your knowledge? And if I can go to you for support to say, does this make sense on the clinical side? That's where we really connect. Okay, it makes sense on the clinical side, and it makes sense financially. And then that's kind of how we provide the best outcomes. Because I know there's been times where I think something's great financially, but it would never be implemented or even work in our institution. So there is that disconnect. I think that I'm still working on that bridge with people coming and going and new surgeons even coming on. There is that, hey, what do you need to do your job and what do you need to provide the best outcomes? And then that's where that communication comes in. We build that bond, and I think that's kind of how we move forward the best.
Cool. Well, thank you, Maurice. It was awesome talking with you.
Yeah, thank you, Chris. I really appreciate it.